Hello, my name is Brian Casey. I'm editor-in-chief of AntMini.com. We're here at the RSNA Spotlight Course, Radiology in the Age of AI in the San Francisco Bay Area. We have with us today Dr. Curtis Langlotz of Stanford University. Dr. Langlotz, thanks for being with us today.
Nice to be here, Brian.
So the RSNA Spotlight Course is a series of courses on AI. It's a relatively new idea that RSNA has come up with, and so you're program director of today's course and tomorrow's course. There's a two-day seminar. Can you tell us a little bit about the idea behind the seminar and what you're trying to accomplish?
Yes, so what we organized with Udo Hoffman and Matt Lundgren, who are the co-course organizers, is a series of AI talks that we thought would be good for where radiologists are right now in their thinking. So I think radiologists realize that AI is real, that these algorithms can produce great results, and the question is, how is it going to relate to my practice? They're looking at vendors who are offering these products. They're thinking about whether they should purchase one of these products or try one of these products in their practice. So we wanted to give radiologists more information about how to make those decisions.
Okay, and so this might be a little bit easier for people to attend. Maybe it's locally in their area, or we don't have to wait until the RSNA or SIM to get all this information.
And we've had a series of these courses now. We had a couple in Paris, actually one just recently in Paris, and this one here in Silicon Valley we thought would be a good location because it draws many of the young companies who are building these algorithms are based in Silicon Valley or have investors in Silicon Valley, and as well some of the research centers, Stanford and UCSF and other places that are doing good research in the area.
Great. So a really good example of that was today's keynote speaker, Professor Andrew Ng, who is not a radiologist, he's actually a data scientist, and you work with him at Stanford University on a lot of these AI and radiology topics, correct?
Exactly. So we have at Stanford a relatively new center for AI and medicine and imaging, which is really an interdisciplinary center that brings together folks like Andrew and folks like Matt Lundgren, myself, Bhavik Patel, Kristen Yom, others who will be speaking at this meeting. We think the combination of data scientists, computer scientists, and radiologists working together is really the sweet spot for this form of research. So we have radiologists who can generate the questions that need to be answered. We have data scientists and computer scientists who know the background, the techniques that are used to build these algorithms, and that generates the science. Often we need new methods, so that's publications and grants, and then new algorithms that we can actually test out in the clinic. So the first algorithm out of our center, which is a bone age algorithm, is now in a multi-institutional trial at 7 other organizations.
Because it sounds like from this morning's discussion, it sounds like one of the big issues in AI and radiology is finding this intersection between what AI is capable of doing and what radiology actually needs, because it doesn't really do radiology any good to have all these algorithms that do things that radiology doesn't need.
Exactly, and so we find that we bring together these teams, which consist of computer scientists, data scientists, often graduate students, postdoctoral scholars, often radiology trainees who come together and as a team solve these important problems that radiologists need to use in the clinic.
Okay, so one of the things that Dr. Ng touched on today was this idea of AI replacing radiologists, and he made actually a great analogy comparing the arrival of the automobile to the impact that it had on horseless carriages.
Yes.
And he said that sure, there were a lot of drivers of horseless carriages that lost their jobs, but we created this whole new industry of drivers for these vehicles.
Yeah, and I think there's a lesson there that he gave for radiologists, which is that the horseless carriage drivers who didn't want to learn how to drive cars, yes, they might have had employment problems. Just as radiologists who can't advance to the next level, can't learn something about AI and use AI in their practice, may have difficulty as well. So I think that courses like this and generally radiologists learning as part of their practice can help radiologists incorporate AI into their practice, as we have incorporated other great innovations. So if you look back in the 1960s and 70s, we were all reading radiographs, and yet we've gone through these revolutions of ultrasound, CT, MR, PACS, and this is just the next wave that radiologists are now practiced at incorporating into our clinic.
So it sounds like the key thing for radiologists is to be open and willing to change their tasks, because as Dr. Ng mentioned today, AI it doesn't automate jobs, it automates tasks.
Exactly. So some of the things that we do that we find tedious might be, measuring lesions, tracking lesions over time. Those are the kinds of tasks that AI is going to be very good at. So in some ways, it'll change our jobs for the better.
Okay.
We'll be doing the things that are cognitively more interesting and challenging for us.
Great. Now, one final topic or point that came up today was whether radiology is adopting AI more slowly than other industries. Do you think that that's a fair critique?
I think it is true that we're adopting it more slowly than, let's say, deployment in advertising, online ads, or other industries like that. But I think it's appropriate because in the healthcare industry, we need to worry about the safety of our patients. And just as we validate new diagnostic algorithms of another kind or even new medications, we need to assure ourselves that those algorithms, those technologies are really beneficial to patients. So I think the progress is rapid in the research lab, and there's some appropriate caution in adoption of the technologies, and that's partly due to the regulatory issues involved and partly due to, I think, appropriate caution on the part of practices not wanting to adopt technologies before they're proven. So I think that we'll see a great deal of work in the next few years on algorithm validation, and in particular on the issue of generalizability. So many of these algorithms are developed in one setting, and then they may be deployed in another setting, and knowing whether they're going to work in that new setting is a very important question. We need to develop efficient methods to validate these algorithms in the setting where they're deployed.
Okay, very good. We'll look forward to seeing that.
Yeah.
Thanks for being with us today.
My pleasure.
Signing off, my name is Brian Casey.